injuries. There's a patient of mine I've seen for many years who was working on top of a large refrigerator, and he fell off of it. And so it messed up his back and his leg and everything, and that's like 25 years ago, this industrial injury. And because it was filed at the time, he's still able to get treatment for that injury. But that was like a really messed up problem. So pain is a signal, like the lights on your car dashboard. If you have a light show up on your dashboard, do you just ignore it and keep driving until...
No.
Some of us do, but it depends on the light, right?
Well, see, that's the reason I don't like taking these drugs, like because I can't tell if I'm injuring myself.
That's true. That's true. That is one of the disadvantages of drugs. They can mask what's actually going on. So I'm going to hand out now a low back pain and stress survey. So as you're filling this out, once you fill out the top part, it's all confidential. At the end of the lecture, as a member of the Foundation for Wellness Professionals, we're asked to do at least 20 or 30 talks a year for the public. And as part of that, we're required to offer a free consultation to people at our office. So this will give some information regarding that, but it also will help you in understanding the lecture more. So check off any of the following symptoms you've experienced in the past 6. It just says 6. Yeah, past 6 weeks.
Oh, 6 weeks.
Yeah. And so if you've had low back pain, and if there's low back pain, it could be burning or stabbing pain, shooting pain, a deep ache, or numbness. Please check the box off as you're going along there if it applies to your situation. Radiating pain down the leg, we just talked about that. As sciatica, but sometimes it is not the sciatic nerve that actually is irritated. There can be muscles themselves just are cramped, and they create a referred pain pattern that seems like it's sciatica, but it is just because the muscle itself is contracted without irritation of the nerve. Loss of bowel control, headaches, migraines, fatigue. At this point, I'd like you to raise your hand if you checked off more than one box. Just raise your hand. Okay. Thank you. And so keep going there. Insomnia, sleep problems, irritability. And then once you get to which of the above bothers you the most, please write and fill that in. Which are the things there? And if you filled in other, and if other is something that bothers you the most, some other symptom, then please fill that in there. Please, how long have you been bothered by this condition? I would like you to answer that on the survey as well. And please describe how it feels or affects you when it is at its worst. And if you want to fill this out for your friend instead of yourself.
Oh, no, I'm filling
All right.
it out for me.
All right.
I don't know that much about it.
Okay.
I want to, like I said, pass it on.
All right. So then, perhaps you're down to number 2, 3, and 4, but number 2, and this is in reference to the symptoms, particularly the one that bothers you the most. Does it cause you to be moody? Does that symptom, it might be a stabbing pain in the low back. Does it cause you to be moody? Or does it cause you to be irritable?
When this is happening?
When it's happening.
Oh.
Yeah. Or does it interrupt your sleep? Many people do find, and I saw today, I'd say the patients, at least 2 people had low back problems, and when they're trying to sleep, they can't get in the right position, they're uncomfortable.
So you're fine, and then you try to roll over and...
Yeah, exactly.
There you go.
A positional change, and it's just, yeah. Does it restrict daily activities? It may also influence or affect your decision making. It's like you're so overwhelmed by the pain, you can't do anything, let alone make a decision.
Yeah, you try to think about whether or not you should bend a certain way, whether or not you should stand on one foot.
That's true. You have to think very clearly.
You have to think.
Yeah.
You're anticipating what's going to happen. You're afraid of the pain.
You do, and people want to avoid that. Absolutely.
Yeah.
So does it decrease your productivity or make you feel exhausted at the end of the day, or even at the beginning of the day? Does it prevent you from being able to work long hours? And does it perhaps cause you to lose patience with your spouse or children? Or perhaps it causes your spouse to lose patience with you?
We never lose patience. Too nice to me.
Restricting household duties hinders ability to exercise or participate in sports, or interfere with the ability to participate in hobbies or other desired activities. So at that point, once you fill that out, then I'm going to move on. So does everyone fill out that top part? All right, well, it's important to understand that if you checked off 2 or more of the symptoms on here, that you have a problem that you should really be addressing. And if what you're doing already is not dealing with it, then you should change. You should take some action. And so hopefully as we go through here, it will help you understand the kinds of actions that you may need to take to help your back. And no symptom is normal. Symptoms are not normal. Now, you may have been in a circumstance over the last, several months where I don't know if anyone had flu symptoms or not, or if they were around a bunch of people who had flu symptoms. But if you were in, for example, if you were in a group of people and everyone had pneumonia, and they were all coughing up blood, heaven forbid, but they were all coughing up blood, well, that would be common among that group. But coughing up blood is not normal. So symptoms are never normal. They might be common, like the symptoms of a burning or stabbing sensation in the back. It's very common for back pain, but it is not normal to have those symptoms. So if you check off more than one of those things, it's not normal for those people.